Good day everyone. Today I will be presenting my thesis defense which addresses post-traumatic stress disorder and its influence on fear return to sport among Indian athletes. This research intends to explore the psychological barrier in the decision to return to sport, specifically whether trauma and fear contribute to it. To understand the significance of these issues, let us first look at the foundation of this study. Based on National Institute of Mental Health, PTSD is a mental disorder caused by traumatic experiences and can severely impact emotional, psychological, and behavioral health. It can be developed by anyone, at any age, and usually the symptoms begin to appear after 3 months of the traumatic event. Clearly, people with PTSD needs to be at RTS level before they can achieve their pre-injury performances or above in the return to play framework. However, there are 4 clusters of PTSD symptoms consisting of flashback, avoidance, and hyperarousal may hinder rehabilitation and RTS. Ultimately, it highlights that mental recovery is equally important as physical recovery, but there are gaps leading us to the problem this study addresses. The first problem statement was discovered by Aaron in 2019, where the prevalence of PTSD among athletes is a significant concern, with rates reported as high 13% to 25% in certain populations, surpassing those in the general populations. Subsequently, there was an increased recognition between mental health and physical recovery. There is a critical need to investigate how PTSD influences rehabilitation and RTS decisions. To address this problem effectively, I defined a set of specific objectives to guide the research process. Firstly, is to determine the severity of PTSD among Indian athletes. The second objective is to determine the level of fear of returning to sports among Indian athletes. And last but not least, is to examine the relationship between PTSD severity and the fear of returning to sport among Indian athletes. Before going into the methodology, it's essential to understand how existing research has framed this topic, which I explore in the literature review. From James' finding, at least 1 in 8 elite athletes are affected by PTSD. Many athletes suffer from undiagnosed PTSD symptoms, and women are more likely to have symptoms than men. Next is that patients who underwent articular cartilage implantation from ACL have higher fear of movement due to fear of re-injury, and their pain scores are less likely to return to sport. Thinking about the worst case scenarios contributed to this reason too. Thirdly, assessment from the injury psychological readiness to RTS and athlete fear avoidance questionnaire revealed 60% of athletes were not ready to return to sport. Additionally, those with severe injuries has low scores. Lastly, the findings for factors of a successful RTS were recorded among ACL reconstruction in soccer players and highlights that professional players have better functional outcomes. In contrast, those with dominant limb injuries had lower mental scores, resulting in poor RTS decisions. After reviewing the literature, I selected methods that best suited the study's aim. The research design I used was cross-sectional study. The reason for this was the observation analyzed data at one time, very quick and inexpensive to conduct. The sample size in this study was 42, and it was based on the journal Seasons and Morangelo 2024, which is Returning to Sport After Injury, the influence of injury appraisals and post-traumatic stress symptoms on adolescent risk-taking intention post-injury. This slide shows the step of my research. First, I got ethical approval to make sure the studies followed the rules. Then, I screened the participants. They had to be 18 to 30 years old, playing individual or team sports, and had a sports injury in the past month. Following that, I shared the questionnaire using Google Forms, and the link was sent out through WhatsApp, Facebook, and Instagram. 2 instruments were used in the study. First is PCL5, which is a self-report questionnaire that helps assess PTSD symptoms. It is based on the DSM-5, which is the standard manual for diagnosing mental disorders. The second tool is FRES, the Fear Return to Sport scale. It measures how afraid athletes are to return to sport after injury. It helps tailor rehab programs to support their mental health and emotional readiness. FRES focuses on things like fear of re-injury, low confidence, anxiety about returning to sport, and social pressure from others. The first questionnaire is the PCL-5 questionnaire. It has 20 items that measure PTSD symptoms based on the DSM-5. It is used to screen people for PTSD and track how their symptoms change over time. The test has been proven reliable with scores between 0.58 and 0.91, according to Focus and colleagues in 2003. Second is the FRES questionnaire. It consisted of 8 items that reflects the thoughts and feelings about RTS. This provides insights to overcome the mental barrier faced by athletes to safely RTS. The test has been proven reliable with a good reliability scores. Following data collection and analysis, the findings reveal several key insights, which I will now present and discuss in more details. This result shows the different type of injury the athletes had. Most of them, about 29%, had ACL injuries, which is in the knee. The next most common was ankle sprain, which was 26%. ACL injuries are known to be linked with PTSD because they are serious and need a long recovery. From Anderson et al. 2021 said that athletes with ACL injuries often had PTSD-like problems where avoiding things, feeling stress, or feeling on edge. So, it is important to have lower stress and anxiety during recovery, so they can return to sport better and feeling well. This table shows the scores for PTSD and fear of returning to sport. The average PTSD score was 29.55, and the cutoff to show probable PTSD is 31. So, the average is a bit low, meaning most athletes did not have a severe PTSD, although the signs were shown. About 43% had moderate PTSD, and this is different from Alexander et al. 2024 findings, who found that almost 29% of baseball players had a high PTSD. Following that, 18% from his studies had severe PTSD after an elbow ligament injury, and 3.8% had no PTSD symptoms at all. Therefore, PTSD levels were different for each person. Now, I will talk about the fear of returning to sport. The average fear score was 57.22 out of 100. This shows a medium level of fear. Fear of movement after injury is called as kinesophobia. Triana et al. 2023 said that people with ACL surgery often had a high fear of movement and pain, so they are less likely to go back to sport. Fear of getting hurt again and negative thoughts make it harder to return. But athletes who have strong confidence and motivations can do better in rehab, as Clay Marie Roberts et al. 2020 found. This slide shows the relationship between PTSD and fear of returning to sport. The correlation is 0.6, which is a strong positive link. The p-value is less than 0.05, so it is a significant finding. This means athletes with higher PTSD scores usually also have more fear of going back to sport. Fear of re-injury, again, is a big reason why some athletes do not return. As reported from Kavis and Silbernagel 2021, they found that fear is a big barrier. Kamal et al. 2024 also found that athletes with high anxiety, depression, and low knee confidence had the lowest return rate, only about 45%. Based on what the study found, I would like to share some recommendations that could help athletes and professionals support a safer return to sport, which is developing a gradual return to sport protocol. The protocol baseline is to execute a psychological screening in the early stage of rehabilitation. Instruments that can be used are PTSD PCL5, FRES, and Tampa Scale of Kinesophobia, which assesses their feelings and thoughts regarding themselves. Next is to provide treatment by initiating cognitive behavioral therapy. It focuses on talk therapy, which is recognized negative thinking and converts it into positive thinking. It may not instantly produce the result, but it is beneficial for athletes in learning to cope and better manage stress. Now that I have discussed the results, I will summarize the main findings and explain their importance. In summary, although PCL5 scores 5 among the athletes were below the clinical threshold for PTSD, many still exhibited key symptoms associated with post-traumatic stress. It confirms that PTSD is a relevant and measurable psychological response to sports injury. Consequently, fear of returning to sport was prevalent even in the absence of a full PTSD diagnosis. These findings highlight the importance of incorporating mental health assessment into rehabilitation protocols to monitor and support the psychological well of injured athletes. Addressing both physical and psychological factors is essential in helping athletes regain confidence and successfully return to their respective sports. Thank you for lending your ears. This is the end of this presentation. Thank you so much.